great, but that you don't have to do the insides. And
Interesting. So if we're brushing your cat's teeth every single day, preferably twice a day, you're still going to have to see your veterinarian at least once or twice a year for their examinations. That's when you'll give the recommendation for possibly a professional tooth cleaning.
Right.
Now, do you normally recommend cats generally get their teeth cleaned at least once a year, or is it on a case-by-case unique basis?
Yeah, the American Animal Hospital Association sat down with dental experts, and I was honored to be one of them. And the recommendation is that at least once a year, cats' teeth are professionally cleaned. And that's regardless what you see, because 60% of the tooth is below the gum line. And if you think about an animal's life being 1 year in people and 6 or 7 years compared to people life, that means you're going to the dentist, or you're taking your cat to the dentist once every 7 years, because a lot of things can go on below the gum line, and especially in cats with tooth resorption. Tooth resorption is a major problem in cats. Half of all cats over 3 years old will have at least one tooth resorption, and they're painful. So it's very important that people go to the veterinarian, get the cat anesthetized. It's safe. The cat is anesthetized, first being evaluated by the veterinarian. Blood tests are done. They're monitored under electrocardiograms. So, you know, the safety worry isn't what it was way back when. So it's very safe to get your teeth professionally cleaned and then follow up with prevention. It's not that you can get your cat's teeth cleaned and all of a sudden things are great. You don't have to do anything. You can imagine if you went to your human dentist, got your teeth cleaned, and then didn't brush your teeth for a year, you'd be in trouble. So it's important that you get friendly with your veterinarian and make sure your cat gets cared for too.
Right. So we go to the veterinarian. We have that professional tooth cleaning done. When do you start the preventative care at home? Especially if those cats have an extraction done, when do you typically tell them to start that preventative care after that professional cleaning and potential extractions?
Usually about a week. Yeah, cats heal wonderfully and they heal really rapidly. So about a week, everything is healed.
All right. We did have a question that came through, and someone wanted to ask, typically, how much does a dental procedure run? And we all know that really depends upon demographics and what your veterinarian does include along with the procedure, such as dental x-rays, as they should be mandatory for every single dentistry that is performed on the cats. Are there any cat foods that you recommend that are better for cats' teeth versus anything else? Do you prefer wet versus dry? Can you kind of get rid of any kind of myths about food for us?
Right. They've done research and they found out that dry food and wet food give the same amount of plaque and tartar. What doesn't give the same amount of plaque and tartar is semi-moist. Semi-moist is the food that you get in the little plastic containers, and they have stickiness, and that stickiness attracts plaque. So it's important that if you're going to give semi-moist food, because it tastes really good for the cats, that the teeth are really attended to twice daily.
Right. You make a good point with that. So if we're wondering about cats that have foods that tend to adhere to the teeth, there are products out there such as sealants, such as Oravet. How do you feel about those kind of products being used on cats, and do they actually work?
Yes, I actually was very honored to do the research for the company that created Oravet. And I have a published article, peer-reviewed, that showed that Oravet, which is a gel that is applied under anesthetic while the cat gets its teeth cleaned, and then by the client once a week afterwards, does decrease the amount of plaque and tartar as time goes on, and halitosis and gingivitis. So we evaluated it very nicely. So Oravet does work. The negative part of it is that it requires the owner to put their finger in their cat's mouth to apply it. And we find that that seems to be the rate limiting step. Even though it's a good product and it works, the client doesn't want to put their finger in the cat's mouth.
Right. So you make a good point on that, because someone did bring a question over about that. Like, what do they do if your cat doesn't like to have their face and head touched? And my go-to is, well, that's where your veterinarian is really important. Do you have any tips at home for people that have cats that won't let them actually do dental care on them?
Absolutely. They could go to vohc.org, Veterinary Oral Health Council.org, which is a nonprofit organization, and it is staffed by volunteer veterinary dentists, and they evaluate dental products, and they accept the dental products that have been shown to at least decrease the accumulation of plaque or tartar by 20%. And there are some oral additives, some water additives that can decrease the production of plaque and tartar. So they can add products to the water. There's gels that you can use, and there are cat chews now that you can use to decrease plaque and tartar. Verbac just came out with one.
Do you have any favorite water additives you'd like to share with the audience?
A lot of people use Healthy Mouth. We use Vetrident. Healthy Mouth is VOHC accepted. Healthy Mouth at this point is no. Vetrident has not received the VOHC acceptance yet. The Healthy Mouth has, but we've used Healthy Mouth for a long time.
Now, how do you mentioned that these certain products have to be approved through the Veterinary Dental Association. How do they go about actually becoming like certified through you guys? Like you guys great. Like give them your seal of approval. Like, how does that happen?
Oh, it's wonderful. So this organization has been around for 25 years, and it is modeled after the ADA. So when you look at your Colgate toothpaste, you'll see a big ADA seal. Well, the products that have been VOHC accepted have a VOHC seal. And in order to achieve that seal, the product has to decrease plaque or tartar, depending on which they go for, or some of them go for both, by at least 20% in 2 double-blinded studies. And they are all listed on vohc.org. There's about 20 cat products, about 50 dog products that have risen to that level. So it's a big kudos to the companies to do it and to keep it. And the products also are considered to be safe. And if there are any problems with them, they certainly take care of them. So it's very good to at least look at the site, and you can get all those products online. There are diets, there are chews, there are wipes, there are quite a few water additives also.
Awesome. Now, I really appreciate you kind of expanding on that. So now we're going to go back to the beginning again about talking about like kittens, like dental care for them, juvenile gingivitis. Why do they get such a stinky mouth when they're starting to develop their adult teeth in? Can you explain to us what's going on in there? And does the dental kit from Base Plus, will that help the owner actually pre-plan potential dental issues in the future?
Sure, absolutely. So let's start from kittenhood. The kitten, when probably about a week or 2 or 3, the baby teeth start to come out. And the adult teeth should be all erupted by 6 to 9 months. But while the baby teeth are being pushed out by the adult teeth, there's bleeding. And it's chronic bleeding in the mouth. And unfortunately, it smells like dead fish. So if there's a bad odor, it could come from that. And that's totally normal. And what the clients can do is use the Q-tip dipped in tuna water and just gently wipe the blood away. And with that, you'll take away plaque and tartar. Now, a totally different disease is juvenile periodontitis, or what they call sometimes juvenile stomatitis, where the cat becomes allergic to the plaque on its teeth, severely allergic, where the gums swell and they're bleeding. And fortunately, most kittens will grow out of it. By a year, year and a half, they grow out of it. But sometimes they won't, and sometimes it turns to full-blown stomatitis, which is a really bad disease that the only treatment that seems to work in most cases is full mouth extraction. And the difference between the periodontitis when they're early juvenile and the stomatitis sometimes can be mitigated by taking your client's cat to the veterinarian, letting them take x-rays. And by the way, x-rays should be done on every single dental exam because 60% of the tooth is below the gum line. In humans, only 20 to 30% of the tooth is below the gum line. But God put cats' teeth with giant roots and you just can't see what's going on below them. So to diagnose tooth resorption, to diagnose periodontal disease, you really need the dental x-rays.
Why do cats, when we talk about tooth resorption, and it's almost as if these cats dissolve their teeth versus developing a cavity like we would or dogs would. Can you explain why that exactly happens with cats?
Yeah, tooth resorption. At one time, we thought they were cavities, but cavities start from the outside of the teeth and they drill and they erode towards the inside. A tooth resorption in cats starts from the inside of the tooth, right at the cementum, right underneath the gum line, drill on the inside and then come out the top sometimes. And when they affect the dentin unfortunately communicates with the pulp itself, with the nerve, and it's very, very painful. So tooth resorption is a major problem. We still don't know what causes it, and the only treatment is extraction. And half the cats over 3 years old will have them. So it's a real common problem.
Do you notice that? I feel like when I do dental x-rays at work, there's always seems to be two particular teeth that seem to be more prone to developing those resorptive lesions first. Why is it always seems to be like the little tiny premolars in the front that start developing the lesions first, and then it kind of like mitigates backwards? Can you kind of give us an idea why maybe that happens?
Yeah, they feel that's because that's where the gums are touching the teeth virtually all the time. And they're really, really close to them. And there may be some pressure reason for that, but it's generally the mandibular or the lower jaw, third premolars on both sides that are much more prone. After that, it's the first molar and then the upper canines.
Gotcha. Well, that's kind of clears things up for us. I do have some other questions that the audience has been sending me. Can the dental test by base paws help avoid extractions in the future or kind of give a prediction of extractions with cats?
What base paws is doing right now is they're amassing study cases to find out if cats that have a certain genome or microbiome are more prone to tooth resorption, to periodontal disease, and to halitosis. And if we could tell the pet owner that your cat is going to, more prone to those diseases, then they can try to help prevent it. Certainly, there's a lot of prevention you could do to periodontal disease. Certainly, there's a lot of prevention you could do to halitosis. Tooth resorption, we don't know how to prevent because we still don't know the cause of it. But it's very important for people to know whether their cat has a tooth resorption. And they found out that there's a certain microbiome and genetic DNA sequence for cats that have tooth resorptions. So if you come back positive for that, you take your cat to the veterinarian and say, here's the result. There's a tooth resorption somewhere, most probably. Go find it and help my cat, because unfortunately, a lot of cats suffer, needlessly, and nobody wants that.
Right. And we just had a really good question that came through about tooth resorption. Normally, it is found in the later stages upon an oral exam. What can owners look for at home to kind of see whether or not their cats are actually starting to have a problem with their teeth that they can maybe take better action against seeing their veterinarian earlier rather than later?
That is a great question, and it's fairly easy. You take that Q-tip that you're dipped in tuna water, and you press it against the gums, the outside surface of the gums of every tooth, top and bottom. And if you find one area is sensitive, especially the bottom first tooth that you see behind the canine tooth, especially that one, if that area is sensitive or bleeding, or you see a hole, take it to the veterinarian.
Gotcha. Right. You bring up a good point for that. We have a lot of questions that are going through in regards to now that their cats have to have a dental done. We have cats now that might have an underlying disease process that they're concerned about, particularly with anesthesia. As a veterinary dentist, how do you feel about cats that might have kidney disease or hypertrophic cardiomyopathy? How do you feel about these cats having dental procedures done on them as well?
Well, there's always a risk with anesthesia. Fortunately, the risk is very, very small. And cats and dogs are evaluated in 5 levels. It's called ASA scoring, where ASA 1 scoring is generally the 6-month to 1-year-old cat or dog that has no problems. It's in for a spay or neuter, or some other really minor procedure, and generally nothing ever happens to those. Then there's, on the other side, stage 5, where you have a 23-year-old cat that is in horrible kidney disease or has squamous cell carcinoma of the mouth and is not doing well at all, hasn't eaten in a week, and that one probably is not going to make it during the procedure. Then most of them, fortunately, are in the middle, and you have stage 2, 3, and 4, and stage 3 is when they have a disease like diabetes or kidney disease and all sorts of diseases that some cats get that are maintained, and they're doing really well on the medicine and the insulin and the thyroid supplements, and everything is copacetic. That's stage 3, and it's very rare for something adverse to happen to them. Stage 4 are the uncompensated ones. Those are the ones that, yes, they have diabetes, but it's not being well controlled, or they have hyperthyroidism and they haven't even started controlling it. So there's greater risk there. And stage 2 is very minimal risk also. So the short answer is, with the veterinarian evaluating the case first by doing blood work and such, then tailoring the anesthesia. There's so many different ways to tailor the anesthesia per patient. It's not one size fits all, not even close. And then very, very important, monitoring them throughout the procedure and making sure that even when they're finished with the procedure, they're monitored in the compartment that they wake up in. And, in our practice, we have all sorts of monitoring. We monitor the CO2 and blood pressure and pulse oximetry and temperature, and we get reports every 2 to 5 minutes, see how the patient's doing. And sometimes we even get a nurse anesthetist to help us. So there's, depending on the case and depending on the severity, generally they walk in, they walk out.
Yeah, I completely agree with you. We see cats all the time with different levels of an anesthetic risk, and we do have to weigh those risks versus benefits for each of those patients. So make sure you have that discussion with your veterinarian to make you more confident that is this procedure necessary for your cat, especially if they are in considerable oral pain. It might be a better benefit for them and, really outweigh those risks as well. We did have one question come through that they wanted to ask if you feel that is canned food that is labeled as the slices and gravies, do you consider that a semi-moist food, or is that a full moist food in your category? Full moist food. Got you. And then I also had a couple of other questions. With someone that wanted to actually check into their cat's mouth at home, they wanted to know, how do you actually go ahead and do that? Because I have a lot of people asking whether or not, is it okay to scruff your cat in order to open their mouth and expose their teeth for brushing? Thank you. I was hoping you would say that. Can you explain this or actually show or demonstrate on your hand that how to actually look at a cat's mouth at home?
Well,
or do you have like a little skull or anything for us to show?
No, imagine this is a cat. And essentially with the head, you with this hand, you kind of hold gently, and with this hand, you just pull things back, and all of a sudden the teeth are exposed. We used to have cats, but my wife's allergic, so no more. We have a dog though. Hey, Riley, you want to get your mouth examined? Riley, come here.
Oh yeah, we get a live demo here.
No, she doesn't. She's not into it. Okay, forget it. But so it's usually pretty easy. And in some cats, you can actually give gabapentin or trazodone that the veterinarian will prescribe, so you could examine your cat's mouth. And that's the whole fear-free. There's a movement that cats should not be stressed. And it's done sometimes with medicine, where you can get medicine from the veterinarian before the visit, and the examination is done in their compartment where they're transported with, or in the car itself. So we try to do everything as stress-free as possible. And the people looking for veterinarians can ask them if they are a fear-free or a cat-friendly practice. Makes a big difference.
Right. So you bring up a good point about that. And so someone actually asked a question a few moments ago on what are your feelings about anesthesia-free dentistry then?
I think it's not a very good idea because with anesthesia-free dentistry, you cannot take dental x-rays. You cannot probe each tooth. And even though they're very good at taking, in most cases, taking the plaque off the crowns, they can't go below the gum line. So people can go online on the college, the AVDC.org, American Veterinary Dental College.org, or on the Foundation for Veterinary Dentistry site, foundationforveterinarydentistry.org. And there's a position statement about anesthesia-free dentistry or non-anesthetic dentistry that kind of, prides itself on the fear of anesthesia for clients. But because of the check the animal first, the tailored anesthesia, and the monitoring, anesthesia is considered very safe now. And it's the only way to do a really good job.
Right. And I completely agree with you on that. We did have a really cool question come through. Someone was asking, what is that brown line that you see on either side of the upper canine and lower canine teeth in cats that tend to stain brown? Does that have anything of significance for cats?
Yes, it's called a blood groove. And what happens, it's for animals, mostly lions, that when they catch their prey, the blood that accumulates goes right down that groove. It's more of a physics thing than anything else, to make it easier for the tooth to go into the animal's neck.
Oh, that's a really cool.
Let's call the.
I think that's such a neat question, because it makes it feel like you really do have like a little lion living in your home. It's like all of a sudden they're like, now I know I actually got something, and the blood kind of goes up and it hits their brain, and they're like, now I feel so good, I accomplished something that day, when they actually do that. So that was actually really cool. Do you have any other fun and quirky like dentition facts that you'd like to share with us about cats?
Yeah, all the way in the back on the bottom, there are two swellings, and they're called molar salivary glands. And some people think they're tumors, but they're not. Totally normal. So don't worry about it.
And those are the ones you kind of have to like flip backwards when we're cleaning the underside of the teeth and stuff. Exactly. So yeah, and each cat is so very unique with them on like the size of them and like how fat they are, depending upon how you irritate them when you're like working inside the mouth. We did have
cats only have 30 teeth, where dogs have 42 and people have 36. So cats don't have too many teeth to take care of. That's why you want to try to take care of each one very well.
Right. And the teeth actually have different purposes too. And I actually had a lot of people ask about the purpose of the incisors. And we call those the grooming teeth. And we tend to see a lot of these cats, those are the first teeth that tend to kind of start wiggling and wobbling the first things to go when they start developing particularly like the higher levels of periodontal disease. Can you explain like why that occurs, especially on the front teeth there?
Yeah, those incisors are actually grabbing teeth versus grooming. They grab things. The canines spear, because they're really sharp and long. And then the premolars hold teeth, and the molars grind food. The incisors have very little bone support, and that's why periodontal disease is affected. The salivary glands come underneath the tongue. So the most common place is the lower incisors to develop periodontal disease. Another really common problem is when the veterinary technicians are cleaning the teeth, they'll see that some of the upper incisors are mobile, and that's because the teeth broke. So
right.
the cat got into a fight or ran into a window or something like that and broke the teeth, and they didn't tell anybody that the tooth is broken, but the tooth was broken and it has to be removed.
Right. So speaking of fractures, you guys just don't pull teeth. And so I want to let the audience know that your veterinarian and your veterinary dentist just don't just extract teeth. You can actually physically repair certain issues in the mouth. Can you explain, do you do braces on cats? Do you just, can you do caps? Can you do crowns? Like, what else can you do other than to simply clean and extract?
Right. So we do braces and we do move teeth, but not to give them a pretty smile. But if they're born, especially a lot of Persian cats are born with the teeth malpositioned, and we put elastics and buttons on the teeth to pull them to the right direction so they'll be functional. We also, for fractured teeth, we do root canal therapy. And that is same materials that we use in humans. We take out the infected nerve and fill the tooth, and that way the tooth generally can last forever. It has a very good prognosis. But obviously the teeth have to be x-rayed first, make sure there's no tooth resorption going on.
Right. You bring a very good point up with that. I do know that we have actually, after we've done our dental x-rays on our part and we've looked in the mouth and we see the cat that has come in with, like, say, a complicated fracture to a canine, and that root looks good, we're like, oh, maybe they would like to actually see the veterinary dentist for a root canal to have this corrected. Mm-hmm. And then we wind up waking the cat up from anesthesia and they go off to the veterinary dentist to have, a different procedure completely done and have it done over there versus with us, so that we can maintain a healthy mouth and the cat actually gets to keep all of their teeth. Mm-hmm. Now, we were discussing just a few moments ago when you're talking about Persians and their malocclusion. Can you explain about a cat's, what their bite is supposed to be like? Because I know people will think about malocclusion as they might have a tooth that's sticking out a weird way, but how does it really affect a cat when their jaw can't close properly?
All right, so there's two different issues you have to consider. There's a malocclusion and malposition. The malposition means that the mouth is fine, it's a scissor bite, life is great, but there's one tooth that is totally out of place. And that tooth we either take out or we move in place. So it's what they call functional, because sometimes the teeth are even inside and make a hole in the palate. Other times they're pushing out the lip the wrong way. And we either cut the tooth in half and restore it, or again, take out the tooth. So that's malposition. But then there's malocclusion, where they have an underbite. And in some cats, like, Persians, that is normal for the breed, but it's an abnormal bite. And sometimes it can cause trouble with the lower teeth actually hanging out front and they dry out. Other times there's an overbite, which the top jaw unfortunately grows too far and the lower canine teeth make holes in the palate. So each case is a little bit different, and our goal is to create a functional, pain-free bite.
Right, and that's very true for every single cat, and each cat's different. Do you find that certain breeds are predisposed to dental disease than others then?
For sure. Maine Coon cats, number one for tooth resorption. Your Egyptian cats for everything. The hairless cats for every, horrible periodontal disease, missing teeth. They are, if we see one of those hairless cats, we almost know that there's going to be dental problems.
Right. And someone just asked, what about Siamese cats? Oriental
Siamese
breed,
cats,
right?
I've had 3 of them. Siamese cats are pretty normal. Sometimes their nose is a little bit too long. Abyssinian cats are very prone to what they call red gum
Yes.
disease, which is stomatitis.
Right. So you said you had 3 Siamese cats. Have you ever had one of your cats actually have it when their front canine teeth start to elongate and they seem
Yes.
to like grow over the years? What causes that in these
Yeah,
cats?
that's called long in the tooth. It's due to periodontal disease. The body is trying to get rid of it. The medical term is super eruption syndrome. And you take an x-ray, it's bad periodontal disease. And if you do nothing, the tooth will fall out. But who wants the cat to have loose teeth along the way?
Right. And then, of course, our audience can go ahead and order the dental care kit from Paws, check to see whether or not their cats are going to be more likely prone to dental disease. So don't forget to check out the website, guys. Get your dental kit, get your DNA kit, see whether or not your cat is going to be predisposed for any kind of future problems. How do you like the DNA kit so far, Dr. Bellows?
It's really cool. It is the future, and working with Paws has been a great experience because they're doing it the right way. They're gathering cases. They're seeing that those cases with certain genomes have certain diseases. They're waiting to come out with formal articles, proving their concept. So I think if we look in 5-10 years from now, diagnosing dental disease is going to be more proactive rather than reactive, which is going to be great.
That's awesome. And this kind of ties into one of the questions that our audience asked. Do you actually recommend seeing a veterinary dental specialist for dental cleanings, or is your primary veterinarian just as capable as you guys to perform dental procedures?
Most primary veterinarians are very capable. And what I would ask your veterinarian is, do they take dental x-rays? Probably half of the veterinarians have dental x-rays, but if they take dental x-rays, and it's not just skull films, it's intraoral dental x-rays, and most of them have the same unit that your human dentist has, very little exposure. Remember, when you do it once a year, it's like once every 7 years in people. So make sure that the veterinarian takes the dental x-rays.
Right. And that's very important. I take x-rays every single time on every single patient that comes in for a dental procedure. And the cool thing about it is on many of the programs, you can pull up last year's x-rays and do the comparison to see if, follow the trends on these cats. And it's really important because you can have a major difference between 1 year to the next year and see actually how this cat's disease is progressing. So it is important, guys, to have your cat's x-rays done every single time. I did have a question come through about a cat that's going to be 11 in March, and his last dental cleaning was in 2016. And he currently has a yearly exam in the past 5 years, and his doctor said that his teeth and gum look very healthy through each exam. But he takes medications such as fluokinase, albuterol, prednisolone, and Xenaquin. And they want to know, do those medications over time, can they actually affect the health of their teeth and gums?
No, obviously.
Do you know of any medications that would affect oral health in cats in general?
Not adversely. Yeah, well, any of your beta blockers could. They use that, especially in dogs. The blood pressure medicine, phenobarbital, will cause an overgrowth of gum tissue in some dogs. Cyclosporin will also, but it's very rare in cats.
Right. That's really interesting. I'm going through all the questions that we have. And I don't want to take up too much of your time, saying everybody else's time. We do have a question in regards to kittens when they're starting to lose their teeth. And you mentioned that by the time they're 6 to 9 months of age, their adult teeth should be in. What happens when those kittens keep retained teeth? Are they allowed to have that second canine hanging back there? Should they have them removed, or should they wait for them to fall out on their own?
Well, if they have a double set of teeth, if you see two canines, then you need to go to the veterinarian. And it's like putting two of your feet in one shoe. There's not enough room. And the adult tooth is going to many times move to the wrong place. So the veterinarian needs to gently remove under anesthesia the baby tooth if it's coming in on the side versus pushing out the adult tooth. Or the other way around.
That's an awesome answer. Let me go through these questions a little bit more. Let's see. We still have so many questions about toothpaste. How much of a product should you be using when you're actually using a physical product? Like if you decide you are going to use toothpaste, not just to use as like, you know, more of like a positive reinforcement, since they tend to be a little tasty in some brands, but like how much should you be using? Like a pea size? Like this is the question someone is asking,
Sure.
like exactly how much should you be putting on their toothbrush?
Not much, because it doesn't do much.
Right. Can you give us a size, like pea size, chickpea size?
Depends on the size of the cat. A pea size has that.
10 the size of the cat. Okay. What about treats? A lot of people are asking about dental treats. Do you think that they actually do their job, or do you think they should just maintain staying a treat, and how many should they be getting every single day?
Great question. And unfortunately, any company can write whatever they want on the bag as long as it doesn't make a claim against the disease. So they can't say that cures periodontal disease or decreases gingivitis, but they can say whitens teeth, freshens breath, gluten-free, all natural. And unfortunately, there's no research behind a lot of it. So for people that are going to give their cats treats, go to vohc.org, veterinaryoralhealthcouncil.org, and you'll see the treats that are considered safe and at least decrease plaque and tartar by 20%.
Right. Now you mentioned staining. Can you actually remove staining from a teeth? And like, is it caused by food? Is it caused by medication? What is it caused by when a cat's teeth actually stain, even though they've had a cleaning, we removed that plaque and tartar, and teeth are still kind of like dingy looking? Can you give us an explanation why?
Yeah, because sometimes they have rough enamel or exposed dentin that takes the food coloring on. And that's why at a veterinary dentist, at a regular veterinarian, once the teeth are cleaned, they're also polished to polish it smooth like our teeth. But unless they're brushed every day, you know, stain can accumulate. Stain itself doesn't do any damage.
Okay. Well, thank you for that answer. I do have some questions that people have asked ahead of time about the base paws tests and reports. Would you be able to answer some of those for us?
Yeah, they're really cool. They have spent a lot of time with PhD researchers to actually come up with reports that at this point don't really 100% say, if it comes this way, your animal has a tooth resorption or has halitosis or has periodontal disease, but they kind of give a lot of information about those diseases. And they say, you know, cats with this genome, this microbiome, have been shown to have those diseases. As time goes on, with the more research that they're gathering, they'll be able to get more definitive, but the reports are really, really classy. They're nice.
Right. And I remember reading about, because my cats have had the dental kits done, and they actually are very detailed with the cat's oral microbiome and how each bacteria can kind of play a role in your cat's oral health. Now, one of the questions was, the cat that they particularly have has a quote unquote low risk for dental health. Should they be concerned about that? And should they still be seeing their veterinarian every single year or twice a year just to double check and make sure that no problems need to be addressed?
Absolutely. Yeah. It's not, it's almost like the BRCA gene, but it's not like the BRCA gene, where you would know that, oh yeah, I have a predisposed to, breast cancer, I'm going to get myself checked. But even if I didn't have it, I was going to get myself checked. So seeing the veterinarian twice a year is a very good idea.
Right. And someone also made a really good question about if they went ahead and they actually had their cat's teeth cleaned, can they still go ahead and use the test? And will their score actually go down if they've retested the cat, say, maybe a few weeks after having their dental cleaning? Will it change?
That's going to be the future beauty of the test. I hope that, let's say you have a tooth, it shows that there's a good chance there's a tooth resorption there. And then the veterinarian takes out 2 or 3 tooth resorptions, and then they test again, and it comes back negative. Mm-hmm. And then every 6 months they test, and it comes back positive again. So there's another tooth resorption. So it's a really neat way of keeping on top of periodontal disease, halitosis, and tooth resorption, we hope.
Well, I'm super excited about these tests. Remember, guys, you can go ahead and go to Paws. You can get your own dental kit for your cat. Not only that, you can still go ahead and get the regular DNA kit for everybody in your house. It's a fun test to do. And especially the reports that are come back are incredibly detailed for each cat. And they update them when new information comes out. So you just don't get one report. You might get an updated report as more information comes through. So your cat's information is in the database constantly and getting updated. So you never know what you're going to find for the future. Dr. Bellows, thank you so much for a fantastic evening. Sure. Everybody, if we didn't get to your questions, feel free to contact Paws. They'll answer them for you. Dr. Bellows or I can go ahead and try to answer a few of the questions as well. But have a fantastic evening, and I hope you guys join us